takes just a little tweaking as you go. You feel like you have your bed all created and open real well, but invariably there'll be a little bit of the subcu fascia that has little threads in it. Go back and break those apart. In most cases, the size of the material you see is big enough for a very large ear, and even though it'd be ideal to have the webbing go around both ends after it's installed, but almost always it's longer than your incision is. So you're going to have to trim one end that then doesn't have webbing past it. So put one end where you can leave the webbing on there and the other end not. And I usually try to leave the webbing on the bottom end, but it could work either way. That's just my choice. And I approximate the size that I'm going to need to cut by just placing it in there. You get a feel then for how wide the ear is, how wide your central stay is. That's really the rigid portion of the implant. And then we'll just cut it with your regular scissors. When you cut it, that's in a little sleeve. You can go back then and taper the rigid portion with your scissors. Try to cut off sharp points so it's not as bad to maybe want to migrate or irritate from the sharp point in the tissue there that may bend. This is an aside, but it's important to know as you're talking with the owners of the dog that you're working on, that anytime there is a rigid or semi-rigid implant installed, you have some degree of less flexibility because of the rigidness of the tissue to be effective at making it stand, giving it support. But you can sometimes get the ear where it looks less flexible, movable, controllable with the dog's muscles as maybe the other ear that does not have the implant material in there. So that is a given, and but if you know that ahead of time, owners and veterinarians, to be aware that that ear may always look a little more stiff or something than the other ear, and less control on the dog's ability to move it around with as much flexibility. Now we're going to take off approximately the amount of the webbing material, which is important for it to revascularize and lay down the fibrin to form the matrix then of the new scar tissue with the support of the PermaStay implant. Okay, this is approximately what we have. I'll try to put it in there, and then we'll go back and either open up a little more on the bed that we've created or trim down a little bit more on the tissue itself, on the implant itself. Sometimes you can get a little bit better hold and all if you'll use a small forceps. These are just a small mosquito forceps with a curved to get hold of, to give you some pressure to help get it installed a little better. I'm going to take a little bit more off and open the bed up just a little more. I'm still trying to leave a little bit of the webbing at the bottom. You're trimming, you'll get bits and pieces. That's what I'm noticing just now of your webbing on your scissors or instruments, and you don't need that in there extra, so watch for that and get your little gibbles that you've trimmed off out of your way. Mainly now I'm just checking to see where the fibrin attachments and subacute fascia is still there. I need to open this a little more with scissors now at the bottom. I have the incision made through the skin and most of the cartilage on this side, but on the inside of the cartilage it's still intact, and I need that extra space to get the implant in there. So now I'm just cutting the cartilage all the way through. The cartilage goes back together well and helps really with the rigidity of your procedure once it scars after the PermaStay is installed. Patience at this point, working little by little by little. You learn with experience after you do some of them to estimate fairly close, but you never get it exactly right the first shot, it seems. Curved crowel helps to hold your semi-flexible implant a little more sturdy as you're placing it. The base feels good now, and of course you have to bend it some to get it to go up inside. And if need be, I'll cut the incision a little longer at the top to get it to slip in there. I think I will go ahead and do that. Go maybe another 1/4 inch. Mosquito forceps to work your edge around your last little bit here to get it in there. The results you see there with the support of the implant shows you that the bend, which was right here, already that the PermaStay has given enough internal support there to take that ear right back up. As far as suturing, I use PDS aught or Vicryl, either one. The PDS winds up not absorbing as quickly as Vicryl, and sometimes you would like that little bit of extra days to leave the stitches in, and the Vicryl's already absorbing, so you can make your choice on the suture. It's not critical which you use. I'm just trying to tweak it a little bit to get the stay located as nearly as possible where we want it.